Hello, I'm Eleanor Hayes from Birthzang, and today I'm going to talk you through my top 7 tips for helping pelvic pain during pregnancy. Pelvic pain is something that's experienced by many mums during pregnancy and can be quite anything from quite mild niggling pains to incredibly severe pain and immobility, perhaps needing crutches to help you get around. There's no substitute for talking to your midwife and your GP about ways to help. There are also a lot of things that you can do yourself to try and mitigate the pain. So my number one absolute top tip, and if you don't look at anything else or don't do anything else, please do this. That is to keep your knees no wider than your hips at any time. So you want to keep your legs quite straight, keep your knees together as much as possible. There is a bit of movement you can make, but try to restrict that as much as possible. And what that will do is really help to relieve the pressure and to not put any undue stress on your already overstretched ligaments. And it's really important to try to maintain this because it will help to minimise the pain that you're experiencing. The second tip to help with pelvic pain is to think about your posture. There's 2 ways you can do this. Firstly, you can try and lift up your breastbone as much as possible, particularly when you're standing, walking and sitting, perhaps at a computer or watching telly. What that does is it helps create more space in your abdomen and helps to lift the baby a little bit out of your pelvis and take a bit of the pressure off that area. The second thing you can do is just to slightly tuck your pelvis under, particularly when you're walking, and that helps to encourage good alignment and a good posture to encourage the pelvis to be able to support your body fully. My third tip today is to wear decent shoes, good shoes that are supporting your feet. So probably try to avoid things like flip-flops, and also 6-inch heels just aren't really going to help. Trainers are great, or proper shoes that fit you properly. My fourth tip for helping pelvic pain is to avoid all lifting as much as possible. This isn't just heavy shopping, but really anything. And in fact, a general rule of thumb is to not lift anything heavier than your handbag. It can be difficult if you've got small children whilst you're pregnant, of course. But as much as you can, try to avoid lifting them. And if you do lift them, perhaps think about getting a baby carrier that can help take some of the weight out of carrying them. My fifth top tip is to avoid constipation and to keep healthy bowel movements. Any pressure and undue stress in this area is really not going to help with any pain. And you can encourage healthy bowel movements by eating lots of foods. For example, prunes, dates, coconut all have a natural laxative effect. And many women suffer constipation anyway during pregnancy, so never a bad thing to make sure you have good bowel health during this time. My sixth top tip is to find a support belt. You may be able to get one through the NHS, but there's lots of places online you can buy them. And it basically provides a really great big band of support around your pelvis and literally holds the pelvis in place, which is a really great way to support that area and can really help to relieve pain. My final tip, number 7, is to go and see an osteopath or a chiropractor. Both of these practitioners are masters at aligning all of your body, including your pelvis, and helping to relieve any tension and stiffness in that area. And it's amazing how quite a few sessions with somebody like that during your pregnancy can not only help your body really, regain its movement, reduce a lot of pain, and also help your body prepare for labour and birth. I hope these tips have been helpful. If you want any or more information on any of them, I've got a blog post at my website, birthzang.co.uk, and there's also references there if you want to look into it any further. But I go to say thanks very much for listening and speak to you soon.